We may look back on this day and this action as being the most significant action taken during this administration. It could be, because when we consider what cancer does each year in the United States, we find that more people each year die of cancer in the United States than all the Americans who lost their lives in World War II. This shows us what is at stake. It tells us why I sent a message to the Congress the first of this year, which provided for a national commitment for the conquest of cancer, to attempt to find a cure.
As a result of the nation's investment in clinical cancer research, more people are surviving cancer than ever before. Today, 2 out of 3 people live at least 5 years after a cancer diagnosis, up from roughly 1 out of 2 in the 1970s. The nation's cancer death rate has dropped 18% since the early 1990s, reversing decades of increases. This progress reflects advances over the last 40 years in every area of cancer care: prevention, screening, chemotherapy, surgery, radiation, and increasingly, molecularly targeted treatments. At the same time, better ways of managing nausea, pain, and other side effects are enabling patients to live better, more fulfilling lives. There have been several milestones in the war against cancer. Let's look in on a few. As we all know, on December 23, 1971, President Richard M. Nixon signed the National Cancer Act, which authorized the NCI director to coordinate all activities of the National Cancer Program, establish national cancer research centers, and establish national cancer control programs. In 1978, the Food and Drug Administration approved tamoxifen, an anti-estrogen drug originally developed as a birth control treatment for the treatment of breast cancer. Tamoxifen represents the first in a class of drugs known as selective estrogen receptor modulators to be approved for cancer therapy. In 1979, the TP53 gene, also called P53, the most commonly mutated gene in human cancer, was discovered. It is a tumor suppressor gene, meaning its protein product helps control cell proliferation and suppress tumor growth. In 1985, results from an NCI-supported clinical trial showed that women with early-stage breast cancer who were treated with breast-conserving surgery followed by whole breast radiation therapy had similar rates of overall survival and disease-free survival as women who were treated with the mastectomy alone. In 1998, results of the NCI-sponsored breast cancer prevention trial showed that the anti-estrogen drug, tamoxifen, can reduce the incidence of breast cancer among women who are at increased risk by about 50%. The FDA approved tamoxifen to reduce the incidence of breast cancer in women at increased risk. In 2003, results of an NCI-sponsored prostate cancer prevention trial showed that the drug finasteride, which reduces the production of male hormones in the body, lowers a male's risk of prostate cancer by about 25%. In 2010, the FDA approved Sipuleucel-T, a cancer treatment vaccine that is made using a patient's own immune system cells, for the treatment of metastatic prostate cancer that no longer responds to hormonal therapy. It is the first, and so far the only, human cancer treatment vaccine to be approved. In 2014, analyzing DNA in cancer became a thing. The Cancer Genome Atlas Project, a joint effort by NCI and the National Human Genome Research Institute to analyze the DNA and other molecular changes in more than 30 types of human cancer, found that stomach cancer is actually 4 different diseases, not just one, based on differing tumor characteristics. The finding and other related projects may potentially lead to a new classification system for cancer, in which cancers are classified by their molecular abnormalities as well as their organ or tissue site of origin. As we have seen, there have been many milestones in cancer research, but of course we have a long way to go. So I leave you with this discussion question: do you think the cure to cancer will be in prevention or in treatment? What do you think will be the next big milestone in cancer research?